Hey, what is up everyone? Today we're going to learn some simple Ayurvedic treatment practices for some common chronic ailments like high blood pressure, high cholesterol, among others. Hi, I'm Risa Morimoto, your host, and you're watching Modern Aging, where we chat about innovative and holistic ways to care for one another as we age. By clicking on that subscribe button and that little bell, you'll always be sure to be notified when new episodes are uploaded. You could always also sign up onto our email list at thisismodernaging.com. Today's guest is Dr. Baswati Bhattacharya. She's an Ayurvedic and holistic family doctor, author, and director of the Dinacharya Institute in New York City, where she teaches workshops and training programs for Ayurvedic health coaches. She was trained as a biomedical scientist, an international public health specialist, and a primary care physician prior to dedicating her practice to Ayurveda. I just love the simple way that Baswati uses Ayurveda to teach us how to rebalance ourselves for better health. So check it out. Baswati, today we are going to do something really fun, right? So people are suffering all different kinds of ailments. And so I thought it'd be really great. Well, actually, this was your idea to kind of come up with the Ayurveda remedy for some chronic illnesses that people suffer from on a day-to-day basis, and what people can do, simple things that people can do at home, right? Okay, say someone has high blood pressure. I suffer from chronic high blood pressure, hypertension.
How do you know that you have high blood pressure? What are the symptoms that you get?
The symptoms I get that I can feel the heaviness.
In your neck?
No, I guess in the chest.
Okay.
And I guess in my head, if my blood pressure is high. But it's also hereditary. My mother suffered from a massive stroke at 65, so I'm kind of really paranoid about it.
So Ayurveda would say, first of all, clean out your blood. So a liver cleanse with something like amalaki. A lot of the herbs I'm going to say are things that you should go to an Ayurvedic physician. And as they prescribe them for you, you take them, but ask the physician not to just give you the powder, but to write the names of the herbs on the container. What I sometimes do is, if my patients really want to learn, I will give them the names of the herbs and the quantity or the proportion and let them go buy it themselves. And that way they can educate themselves as they take the medicine. And that way they own the medicine so much more. The herbs to look for are particular for each person. I can't say that every blood pressure patient will be the same. So in your case, because you tend to have headaches, because you have a hereditary background, and because your blood flowing through is within your lifestyle, which is one of traveling a lot, I would first clean out your liver. I would give you cleaning items. So for example, pearls are very cooling.
What do you mean pearls? Like actual pearls?
I would have you wear pearls on your ears, wear a pearl strand. These are actually malachite, but a strand like this around your neck. Really? And that will cool down your body, and you'll find that because it's around your head, but they can't be hanging pearls. They have to actually sit on your ears. This is in acupuncture and in the homunculus, which is like the map of the body. This represents the head. So this area where it's pierced is the head. And so we can use pearls on our neck, on the back. It comes around the back of the neck. And then there is a herb, or there's a compound called Muktavati. M-U-K-T-A is pearl, Muktavati. So for your blood pressure, if you take the pearls and you grind, not you, but the person that made it, ground it, and then they baked it, and it made it into fine ash. And you can buy that as Mukta Vati or Mukta Bhasma. And you take 1 or 2 of those pills twice a day, your blood pressure will slowly come down. I've had people such as Wall Street, high pressure, stressed out people who have very high blood pressure come in. I have them continue their blood pressure medicine and start the Muktavati, and slowly over time, this one is decreased and this one stays even, and then slowly this one can just be completely weaned.
Yeah, that's the dream.
And then this Muktavati is all that they take. And then after 1 or 2 months, we evaluate and we slowly start taking this down. And as the body has cooled and as the elasticity of the blood vessel has regained its ability, to compress when needed and to relax when needed, we just discontinue the Muktavati. And on many people, essential hypertension, which is 85% of the main population, is unknown for its cause. Its cause is unknown. So what does that mean? Modern medicine is giving millions, hundreds of millions of people medicines. They don't even know what the cause of the disease is. So we have to think about that. We have to think about why we blindly accept that. I understand that high blood pressure is a leading cause of stroke, so I will not advise anyone watching this video to simply start reducing their blood pressure medicine. But with an Ayurvedic physician, in line with whatever they're taking, there are ways to reduce blood pressure. I've had people who are taking supplements thinking they're good for them, thinking that supplement is just the one ingredient, and then we read through all the different 40 things that are in the supplement, and it turns out a few of them are actually raising the blood pressure. And when we discontinue that one supplement, the blood pressure comes down. So the need to have a doctor who is aware of herbs but also aware of pharmaceuticals, and they're not that common, but there are several people like me out there. If someone like that can take you through your medicines, then many times the blood pressure is just this issue that your body is not finding a good balance, and you can bring that back into balance.
That's
very
awesome.
doable.
I'm very excited to try that.
Yeah, but the Muktavati you have to try because it will really bring down your temper.
Wow.
And that
My temper,
shortness-
that too?
The shortness, yeah, the shortness of temper that happens. Most people that have blood pressure issues have a temper. Yeah, absolutely.
Don't say anything.
I was going to say, please just, can we have like an extra bottle of this?
Yeah, I mean, if you want, come down and just do a visit with me. Do like a short visit, and I'll just one by one just get you everything, and just you
That
can
would be
pick it
awesome.
up.
People, also very common, which I suffer from, is thyroid issues.
Thyroid issues are very easy to solve when we don't think of them as thyroid issues. Thyroid is the master hormone. There is something called the pineal gland that looks at the cycle of day and night. It talks to the hypothalamus, which talks to the pituitary. Both are in the brain. They come up with a series of chemicals that they talk to each other with. And then those chemicals from the pituitary, the thyrotropin releasing hormone and the thyroid stimulating hormone, get released into the body and talk to the thyroid. The thyroid then puts out this iodine-based chemical, which is called T3 or T4, thyroid hormone. We make it in our own bodies. When it's not being made, it's like that factory that is not making things in the sequence that it needs to be. So once we put our body back in sequence, thyroid problems go away. Ayurveda did not see thyroid as a separate organ. It does have a handful of remedies that we use, herbs, combinations, that can actually restore the balance in the thyroid. But that balance has to be done with a strong daily routine, a good set of fresh foods, and then these herbs that might work in coordination with the daily routine.
Wow. So what are some of those herbs?
So the herbs
So
will
in
depend
terms,
on
I'm
the
sorry,
patient.
let me go back. So when you say daily routine, you're talking about the Ayurvedic daily routine.
Ayurvedic daily routine, that's right. And the herbs are actually available over the counter as dietary supplements in the United States, but they should be coordinated with each patient's symptoms directly. So, herbs like Kanchanar Google or Guduchi again depend on your antibodies in your body. Why do you have hypothyroid? What is going on in your vitamin D and calcium distribution and production, which are more about the parathyroid than the thyroid, but they're all interacting. The thyroid hormone is considered to be completely separate than everything else in modern medicine. So the solution is just to replenish the thyroid by giving Synthroid or levothyroxine. Right. However, Ayurveda says work on your daily routine, work on cleaning out your blood, and then see what happens. And a lot of people just resolve their issues. In fact, there are many reports of people who have naturally resolved their thyroid problems, and they've written books about it. So there's quite a few books out there on healing your thyroid naturally.
Wow, that's awesome. A lot of people suffer from high cholesterol.
So it's more the balance of cholesterol that's an issue than the high cholesterol per se. And the first and foremost thing is that you have to look at your liver health. So revving up your enzymes. When I say clean the liver, what I'm talking about is revving up the enzymes of the liver and cleaning out that schmutz that's in the liver so that those enzymes can come back to functioning. Once that happens, the liver will naturally take the cholesterol that's hanging out around the body. If the body has sequestered that cholesterol into places where you can't find it, it's more difficult. But generally, if it's in the bloodstream, which is why you say you have high cholesterol, that circulating blood is getting filtered by the liver every minute of the day. And when the liver is functioning, it will not allow that cholesterol to just hang out in excess in the blood. It will filter it out, it will take it, and it will transform it into building blocks to make more cells. Why isn't it doing it today? That's why you have high cholesterol. So getting the liver to do that function again is really the
So with
high
cholesterol.
So high cholesterol is begging the question, why is the liver not processing? It's not begging the question of, there's high cholesterol, let's do a anti-cholesterol suppressor.
Right.
It's saying, let's get the liver to function more optimally. So what we do when we take statins or when we take cholesterol blocking agents is we don't allow the liver to function at an optimal level. We actually shut down the liver. And so out the back end comes all kinds of other problems with the liver. Ayurveda talks about getting into optimal function by cleaning out whatever is in the liver that doesn't allow it to sense the cholesterol, waking up the senses. Just as we wash our eyes and our nose in the morning so we can see and smell better, the liver needs to be washed out. And there are herbs that wash it out. There's kutki, there's amalaki, there's bhumi amalaki. There are at least 10 different herbs that rev up the liver in different ways. Those herbs, coincidentally, are warned by mainstream physicians, don't take these because they'll interfere with your drugs, rather than saying, take these medicines so they'll clean out your liver and then reassess as to whether or not you even need the drugs that we're giving you.
Right.
It's a different approach.
Yeah, it's complicated, right? Because it's with these prescription drugs, you're dealing with, drug companies who need to make money, and that's a whole other.
We buy into that complication. If I don't need the pharmaceutical companies to make money and what I need is a patient to feel better, then I will just focus on whatever the patient needs to feel better without the other agendas being barked in my ear. So when people say, oh, it's going to interfere with my other drugs, I ask them, are you committed to taking the other drugs or are you committed to your liver?
Right.
And when people come to me, they generally come because they are committed to their livers. And so when we clean out their livers and they wake up in the morning the way they used to when they were young without an alarm clock, and they have boundless energy and they can go for their morning walk, and slowly they feel like that cloud that's over their kind of mind and their mood has started to lift, those qualities are the telltale signs that their liver is cleaning up. And if you think about all the symbolic emotions that are assigned to the liver, whether it's resentment or anger or that irritability, when those go away and that energy comes back, people are able to respond to their lives and choose whether or not they want to take a drug that is debilitating their liver in blind messages that say that it's going to contain their cholesterol or lower their cholesterol. But if it's really lowering your cholesterol, then why do you have to keep taking it? And the moment you stop taking it, your cholesterol comes up. That means there's something inherently in the function of the liver that's not working. So that logical argument is not being spoken by enough doctors. And the question is why? Why aren't people talking logically about the body in the way that we already understand it? Ayurveda has been. For 5,000 years, Ayurvedic scriptures have talked, I say scriptures, they're just text in Sanskrit, and they have been talking about the need for this pitta that is housed in the liver that's called Ranjaka pitta. It is giving us a complete optimal functioning of the liver as the goal. And saying that when your pitta is high and you're very angry, You're very bilious in your personality. That means your bile that the liver makes, that it stores in the gallbladder, is not being made properly or is not being stored properly. So clean out the liver and watch the anger come down. Watch the tendency for the yellowish, the strip. If you look under your tongue and there's a yellow strip there, they say you're jaundiced. Some people get jaundiced because their liver is functioning so poorly, and they just go and take a drug rather than trying to solve the jaundice.
Right. Well, I think that's kind of how we've been trained. It's the marketing, right? Just take a pill, instead of like trying to find the root of the problem.
Well, we've been trained not to look at the root of the problem. We've been trained to listen to the doctor and not take our own bodies into our own jurisdiction. Why is it the hospital's duty to take care of my body? Why is it the hospital's duty to keep me well? If I have a genetic predisposition, for example, of having a stroke or having Alzheimer's, why is it the hospital's or the doctor's duty to keep me well and not my duty to say, I have this family history. I need to eat more green vegetables. I need to get exercise every day. That doesn't mean when I hit 65 after I retire, because I might get Alzheimer's. That's today from the age of 35. I need to be getting exercise. And more than the checklist, I need to live happily. If we live happily, if our minds and our hearts are singing, when I think about my partner and my heart sings, there's a release of some kind of chemical. People can feel it oozing out from their heart. That is what sets everything in harmony in our bodies. And if people don't believe that, just go and look at two people that are successful. One is deeply unhappy. One is just very happy with the family that he or she has created. And their health go in very different trajectories. If you see people that retire at the age of 55 and do what they love in the years when they have, they live till 80. If you look at people that work and work and work till 65 to make a little bit more money, a huge number of them have defined work as their reason for existence, and in fact they have not tended to their relationships. And what happens to them is they retire and they die at 67. So they are living to work, and when the work is gone, they have no reason for living, and they're not inherently happy. For those people who say, my work is my life, like you and me, I love my work. So a friend of mine was saying, oh, I have to go to work today. And she was kind of mourning the fact that she had to go. And I thought about it and I realized, I don't consider going to work as any different than living my life.
Right.
It's just a different part of my routine. And that happiness that I've given to myself is something that most doctors have not given to themselves. And they suffer from chronic fatigue, and they suffer from insomnia, and they suffer from arthritis, and they suffer from heartbreak. Heart disease is heartbreak. And they suffer from thyroid problems. I am the only person I know in my cohort of doctors who is not on any prescription medicine nor needs to take any prescription medicine. And I get my blood work tested every year since I'm in that high risk zone, and I'm healthy. So that happiness, that living in a happy way is one of the best drugs that we can have circulating through our body.
That's awesome.